Hi everyone, this is Dr. Johnson. In this lecture, we'll be talking about principles of learning. And when I'm talking about principles of learning, I'm talking about really looking at the differences between teaching and learning and then steps to plan effective education. You will eventually learn about the different approaches next week. So I want you to pause and think about a time when you were in class learning. What made you remember it, and what was impactful from the teacher perspective? So, essentially, what did the teacher do to enhance your learning? It's important to understand that there is a difference between teaching and learning. During the teaching process, it's important to use things like assessment. So, maybe even just asking a question, such as, "Can you tell me what a carbohydrate is?" This allows you to determine who in the room knows what type of foods are considered carbohydrates compared to those who have no idea how to classify food groups. Teaching involves the technique of transferring knowledge from the expert to the learner. So, learning is the process of actually storing that information that is transferred from the teacher. So, there are ways that we can go about this that we can be more effective. You've probably even yourself learned how you best learn, whether it's hands on, whether it's reading, whether it's hearing something. We all learn a little bit different. Therefore, it's important to use different modalities to reach all the different learning styles. What about the environment? What factors should you, as a nutrition educator, consider for group classes? Remember, in a group of class, you're going to have diverse learning styles, you're going to have diverse backgrounds, and you're also going to have people from different, basically, economic statuses, potentially, not all the time, but there could be a wide variety of income levels. We need to think about the physical space as well as the psychological space. There's a lot of misconceptions about nutrition that people can bring in psychology wise. And we want to be supportive and friendly of those different thought patterns. We also want to tolerate mistakes. So we want to create that environment and that rapport with our group classes and our peers if we're going to do a peer education or even a staff education and training session, that it's okay for people to make these mistakes. The physical environment definitely needs to have proper lighting and temperature. I can recall days when I've been teaching in a classroom and it's so stifling hot outside that the classroom is just stuffy air, and you can certainly tell that students are not paying attention. At that point, there's no point in trying to teach. We also want to facilitate interactive learning. So we want to go from passive learning to active learning. And there's a couple different approaches that we can use. And you've even probably experienced more active learning compared to more passive learning in your education. So here's another time I want you to pause and think about it. If you could create an ideal room for nutrition education, what might it look like? I want you to pause the video and I want you to actually draw this out and really reach hard, because if you can dream it, we can make it. I then want you to write down a list of what are the actual steps that you should take in order to be an effective educator. When we're looking at developing education, we can look at how to effectively design that with these simple steps. We first want to assess learning needs. Now, this could be a group population where we're assessing what are the actual needs of a community. And then we can also do this when we're inside the classroom with the learners and assessing what they understand about nutrition already. This is sometimes when people give a pre-test, because this allows you as the instructor to identify where the class is at. For example, if I'm teaching a class on carbohydrates and I ask everybody to identify carbohydrate foods and everybody can, I don't want to waste my time and their time teaching carbohydrate foods. However, if you have a group of people where the majority don't know, and maybe there's one or two people who can identify carbohydrate food, then we can do more education of laying that foundation of carbohydrates. So this is an important step of assessing the learning needs. Writing objectives, we'll get into in the next lecture, but writing objectives help you to design your actual topic and the lesson activities. With that being said, you also want to determine the educational content. So, exactly what do you want to teach them? And then number 4 is how are you going to teach them? Are you going to have a PowerPoint? Or are you going to have videos? Are you going to have role playing? Are you going to have hands on, maybe cooking? What type of methods will you be using? Then we're going to actually implement that. And we also want to get evaluations. So, anytime you give a presentation, it's always good to get an evaluation from the people who participated. Such as when you all give me teaching evaluations, I can take that information and then I can change and improve the way I teach moving forward. With that, documentation is key. We always want to make sure that we're able to document that we are an effective educator because this can help us sell programs to potential future employers. So let's talk a little bit more about assessment. Why should we do this part within the model of developing effective education? Assessment allows us to have that starting point, and it also defines the gap between what is the current knowledge and desired knowledge with the group of people that you're working with. Every class is going to be different, and depending on where they're at, depends on how big or how small that gap is. Briefly looking at objectives, objectives help communicate the intended outcome of the class. So for example, what should the patient be able to do at the end of your lesson? Or what should the learner be able to do at the end of your lesson? It also helps to focus on personal learning and not the instructor focus. So I can say what I hope people learn, but this is important for if I'm going to put myself in the perspective of the learner, I'm going to focus on that aspect. So we can say the dietitian will teach the client about low sodium foods. After instruction, the client will be able to plan an appropriate menu to comply with a low sodium diet. What's the difference between those two statements? One of them is a little bit more measurable, right? The second, we're giving a time. So we're going to say after instruction, and we're saying that they're going to be able to plan an appropriate menu that complies with a low sodium diet. Because a low sodium diet is defined as less than 1,500 milligrams of sodium per day, we can analyze the menu that they develop and see if they have a working knowledge of foods that are low in sodium. We always want to make sure that we're writing SMART objectives, which we've previously talked about. Now, determining the educational content, it's important to talk about health literacy and how to choose educational content to improve that health literacy. I want you to read the article about what is health literacy. It's important to understand that not everybody truly understands how food impacts our overall health. They might know the basics of eat more fruits and vegetables, however, it goes a lot further and beyond just the basics. This was a really interesting study that showed there was no one best teaching style, and in fact, all of these provided statistically significant improvements in the pre-post test. This particular study had a group of people where they participated in various activities and modalities of learning, such as role playing, doing a grocery store tour, having a PowerPoint presentation, and then the combination of all of them. They looked at 2 outcomes with improving their knowledge about label reading and improving their knowledge about a food guide. Now, if you were to first guess, I would probably say that the only ones you're going to see change would most likely be in the role play and the grocery store tour. However, you can see that the PowerPoint presentation also provided increase in knowledge that was statistically significant. However, if you look at the pre-test and post-test, the difference is a lot greater in those that were able to do role playing. Now, role playing is essential because you are having that hands-on experience combined with that other learning style. It's important when we're choosing a method and a technique to educate our group by knowing the audience. Teaching a group of teenagers, we're going to use a different modality than teaching a group of elderly patients. We also want to use plain language and don't use any slang or medical jargon because that can be really confusing. Now, the caveat here is if you are teaching a group of people or providing an educational in service to, let's say, hospital staff, it is okay to use medical jargon. And definitely try to be authentic. You'll find your rhythm and how you like to educate best, and don't try to be like other people. Now, documentation is key. Documentation is key because this can help you justify that your education is effective and that you as a provider can actually make a large impact by using something that's measurable. For example, this particular group of people looked at how nutritional supplements improved in patients, and that was provided through heavy education about the importance of fatty acid and protein and energy dense foods. What they saw is that they increased the total amount of protein intake and they also improved weights. The quality of life improved significantly after 8 weeks. And so, this is something again where they used measurable data instead of just saying, hey, we made an impact. This is why documentation is key. It's objective information that shows your education was effective. So, in summary, the basics are similar to an ADIME note if you think about it, but on a large scale. You're going to assess the need, you're going to determine the necessary outcomes, you're going to select the best methods to provide that education, and then you're going to measure the outcomes. I hope you enjoyed this brief lecture on learning.